Thank you, Mr. Chair. Dr. Walensky, since this pandemic started as a physician and former director of the Iowa Department of Public Health, I have referred to this as life versus life. Not life versus the economy, not life versus liberty, but life versus life. At that time, I said that we would see, with hospitals closed, with businesses closed, child care closed, that we would see increased deaths from cancer treatments not being given, also cancer not being detected, from drug overdose, suicide, depression, mental health, and now we have certainly that data. We have San Francisco Chronicle published earlier this year that the rate of drug overdose deaths, even with Narcan being rapidly dispensed and in the public, was over 30% higher than it had been the year before. We also know the same statistics out of Japan. We also know from Las Vegas that having closed their schools, what forced the Las Vegas School District to open their schools was the publication that in the New York Times that from March 16th to June 30th of 2020, there were 6 suicides in young children, and between July 1st and December 31st, there were additional 12, 18 suicides, the youngest of which was 9 years old, which is tragic. So my question for you is, do you know how many excess deaths, not COVID, but excess non-COVID related deaths have been incurred during this past year?
There was an MMWR report out today, actually, that describes from January 2020 to February 2021 excess deaths of about 500,000, about 75% of which are attributable to COVID.
Thank you. So, excess deaths of 500,000, which is somewhat similar to what we have. So thank you for that.
75 of which are attributable to COVID. So that's the same.
Non-COVID related excess deaths was what I was asking. But I'll go to my next question, but thank you for that. I was at the border earlier this week in the Rio Grande Valley sector, and thank you, Representative Waters, for bringing up congregating in the elevators and crowding. Because when I was there at the Donna processing facility, that facility was at 420% capacity. They had brought it down from 5,000 per day to 3,500 per day. The facility was not built for that. While I was there, as a woman and a mother, I was concerned about young women being smuggled into the country, brought across without any parental support or parental guidance, and asked them about pregnancy, rape, sexual assault, and they informed me that the week before they had an 11-year-old girl recently pregnant and a girl between 11 and 15 who the day she arrived at that facility gave birth to twins. So does pregnancy put individuals or these young people, they're not being tested for COVID, we already know that, but does it put them at a higher risk for severe illness from COVID-19?
Epidemiologic studies say that outcomes of COVID in pregnant women are increased ICU risk and other things.
Okay. And does the overcapacity in the shelter put them at higher risk for COVID-19?
Crowding is a risk for COVID-19.
Yeah. So I've been working on vaccine hesitancy throughout. As soon as the vaccine, and thank the previous administration and President Trump for getting the vaccine to this point in time, but it's really the nation's vaccine, not a particular president's vaccine. And working on that, and even this weekend on Saturday was able to vaccinate 20 young individuals who were attending a meeting. And so we've talked about vaccine hesitancy and the need to get across that, but I'm wondering if, Mr. Chair, I'd like to introduce this article into the record, if I may. From September of 2020, when Dana Bash asked Vice President Harris if she would get the vaccine, and quote, "I would say that I would not trust Donald Trump, and it would have to be a credible source of information that talks about the efficacy and the reliability of whatever he's talking about. I will not take his word for it." Is this the kind of information you think that also contributes to vaccine hesitancy?
I think we all have a role to get vaccinated, and I would encourage everybody to get vaccinated with the FDA-authorized vaccines.
So I fully respect her freedom of speech, as Dr. Fauci respects Tucker Carlson's, but I think, yes, it's incumbent upon all of us to be transparent, to be ethical, to give information, and this also applies to the how we handled the J&J vaccine as well, to the pause. Thank you so much, and again, I appreciate all of you being here in your testimony today.